Sickle cell disease is a life-threatening blood disorder that impacts over 100,000 people in this country alone and millions of individuals around the world. The disease is unique in that it largely affects Black and Brown patients, and as a result, the intrinsic racism within our healthcare system is laid bare in the care of our patients. We have been so behind in our understanding of the disease that we can't even accurately say how many people are living with it. And for nearly 3 decades, we only had a single drug to manage the symptoms. Sickle cell touches nearly every organ in the body, with patients having everything from a heart attack to a stroke to a joint replacement surgery in their 20s or 30s, all while experiencing the worst pain known to humanity, a pain worse than that of cancer, childbirth, or trauma. Because sickle cell disease induces such severe pain, and because our patients are Black and brown, they are often treated like drug seekers or criminals when they come to the hospital. As most of them have learned to cope with their pain since early childhood, it's often believed that if they don't look like they're in pain, or if their lab tests are entirely normal, that they can't actually be in pain. This is a common and racist misconception. And it's important to emphasize that there is no lab test or imaging study that can accurately identify a painful vaso-occlusive event. The gold standard is the patient or their family's own report of their pain. Our patients need to be heard, and they need to be believed. Their pain is very real. Because of the racial inequities in our healthcare system, patients with sickle cell disease have not been afforded the same treatment options, research attention, or government support granted to other chronic congenital illnesses. Comprehensive research studies to guide our management are lacking, and much of sickle cell disease care is the result of expert opinion, leaving us relying on educated guesses on how to manage some of the most complex or life-threatening complications of the illness. Through the creation of the Comprehensive Sickle Cell Disease Treatment Center, we here at Mass General have created a true medical home for patients living with sickle cell disease. By bringing together a multidisciplinary team that includes nursing, social work, primary care, palliative care, and integrative therapies, as well as specialists from every organ the disease touches, we can ensure that patients have one-stop shopping for the evaluation and treatment of their disease. Outside the 4 walls of this hospital, our team is advocating for sickle cell care on a state and federal level. We've introduced a bill to the Massachusetts State Legislature that will aim to provide equity in sickle cell disease care across the Commonwealth, and we are championing national efforts to accomplish this around the country. We will never allow silence to define the care of sickle cell disease again.